So good morning, good afternoon, good evening from wherever you're joining us. Welcome to this new webinar organized by the Maternal Health Caucus of the Reproductive Health Supplies Coalition in partnership with one of our very active caucus members, Results for Development are for thee. Please remain muted to prevent background noise from your home or your office. And this webinar, as you see, is being recorded, and a link to the audio and video will be sent to all of the members of the caucus and to all the people that have registered in this webinar. You also received some pre-reading material. And if you didn't, I will resend it with the tape of this caucus of this webinar. I will be sending you in a couple days the tape, the recording, as it needs to be processed. This recording will be stored in our website for forever. And I was just mentioning to Leka that we have this huge library that I really invite everybody to look at, because there is quite a wealth of knowledge and information in this webinar library that you can find in our website. So you are most welcome to write your questions in the chat box as they come up. Like, don't wait until the very end. Just start writing them as soon as you have a question. And without further ado, let me introduce our presenter today. And it's my honor to present Leka Puri, who is a program officer on the market sharing practice at Results for Development, and has worked on the increasing access to MNCH medicines project through its 2 phases over 3 years. Previous to her current role, she supported the Stop TB partnership in development of the first venture capital fund to improve TB prevention, treatment, and care interventions. Earlier in her career, she supported the Ministry of Health in Laos on identifying the funding gap and financial opportunities for malaria elimination activities in Laos. She's a public health professional with a master's degree in public health from the very prestigious London School of Hygiene and Tropical Medicine. Welcome, Leka, and the floor is yours. Thank you.
Thanks so much, Milka. That was really, that was cool. It's the first time I've ever been introduced to a group. So good morning, good afternoon, good evening, everyone. My pleasure to speak to you about this project today. After that really awesome introduction from Milka, it's really also great to see in the participants list here on Zoom a lot of familiar names that are coming up. My team already has had some bilateral conversations already with several of you on the call, where we were able to dig into more deeply into the solutions that we'll speak to you about today, and in different geographies that we focused on in this project. So I will note, I'm currently presenting today, but on behalf of our larger team. My colleague Emma Stewart is also on the line as well, so hopefully she can help answer some questions on the chat while I'm speaking to you. So for today, the aim is to share the project background for this project and our findings at a high level with the entire group, as well as stimulate discussion with us about the opportunities in this space to implement the solutions. So we aim to leave about 15 minutes for discussion at the end. So yeah, I can kick off right now for the presentation. So for today, the agenda, as I've mentioned, really the overview, providing the context and scope of our project, outline our approach for how we went through prioritizing the solutions, share high-level solutions that we did find, and then move forward into looking at what does catalytic implementation look like and where, as well as open the floor up for discussion with the entire group on possible implementation and or synergies with other recent work that's ongoing currently in this field. So To kick off, just reviewing quickly the context of this entire project. So this project, phase one of this project started in 2019 with a recognition that market challenges existed within the MNCH market, but there really was a black box around what the specifics were. So there was a lack of data-backed understanding of all of the key challenges and how to drive improvements for the market, and to make sure the right quantities of good quality medicines were entering countries at the right time and at affordable prices. And so this lack of a holistic view of the market really led to our phase one work, which focused on developing a data-driven and bottoms-up picture of the market for MNCH medicines. So we initially started out in phase one with a holistic view of all the primary care medicines in general. And then based on government priorities, we narrowed down to a list of the 14 priority medicines that you're going to see, that you see right now on the left-hand side of this screen, and is the focus of our phase two as well, is focused on this set of medicines. Then we analyzed, in phase one, we analyzed the market for these medicines, and we observed some similar market barriers across the priority MNCH products, which we've grouped into the 4 buckets that you're going to see in the middle of the slide here. So financing, product selection, and then procurement, pricing, and quality, which are distinct but interrelated topics. So we group them together. And then some cross-cutting challenges across all the market buckets is also here at the bottom. We also observed opportunities that could both address these challenges identified and drive market access, which are on the right-hand side of the screen. So for example, under financing in the dark blue box, we saw from our findings that opportunities here to address the market and improve the market ranged from looking at short-term funding gaps and addressing those to, in the longer term, improving effectiveness of donor funding to drive domestic resource use and mobilization. And so the identification of both the market challenges and the possible opportunities here led to our work in phase two, which is the focus of today's presentation and conversation. So just going into a quick overview of our phase two. So in phase one really revealed to us that while market barriers are similar across the MNCH medicines, of our 14 medicines, there aren't any quick wins. They weren't apparent. And there's no one action that's able to transform the market. The dynamics are quite complex, and country context is really important to consider and focus on. And so phase two, therefore, focused on building on these findings from phase one to co-create and prioritize a set of solutions with global, regional, and country level stakeholders. And we looked across the different market buckets, which are back on this slide with the similar color coding. And our focus also remained the same in the sense that from phase one and into phase two, we focused exclusively on the public sector in the same geographies, which are Ethiopia, Tanzania, Kenya, Uganda, and then Kano in Nigeria. And we also focused on the same set of 14 medicines. And the key questions here at the bottom of the slide were that we wanted to address in phase two were first, what are the strategically relevant drivers of the market challenges already identified? 2, how can market shaping solutions be deployed to address the market challenge? 3, which levels would be the most appropriate and effective entry points for the solutions identified? And then lastly, who should be involved or serve as the institutional home to implement these prioritized solutions? So moving into our overall approach for how we ended up prioritizing and co-creating a list of prioritized solutions, we took quite a hypothesized driven and iterative approach to this work, which you'll see on the left-hand side of the screen, where we leveraged first the phase one market analysis information to identify an initial set of hypotheses of what solutions could be. And then we went to a set of stakeholders to consult and pressure test, gather more data, and we iterated and refined those hypotheses in multiple rounds of conversations. So kind of going in this like circular approach here. And on the right-hand side of the screen, you can see many of the different key stakeholders that we consulted at all of the 3 levels that we looked at. So the global, regional, and country levels to get a range of different perspectives to help us arrive at the prioritized solution list. So these key stakeholders included many of you on this call, as I mentioned earlier, as well as programmatic staff at the Ministry of Health in our countries of focus, procurement agencies and national procurement, procurement agents and national procurement agencies, national drug regulatory authorities, implementing partners, wholesalers, donors. So quite a range here. And in the next few slides, I'll walk us through more of the more detailed methodology of how we arrived at the prioritized solutions. So starting off with this slide here, we started off with our initial set of hypothesized solutions, which considered what had been attempted and implemented previously. So within an MNCH product market in our focus geographies, to help us identify a solution that could be scaled up beyond a single MNCH product or beyond a single geography. We also looked at solutions in other product markets and country contexts that could be applicable to MNCH markets and see if that could be expanded, a solution expanded from another product area to MNCH. And then we also considered potential solutions that we didn't see in this landscape, but in our iterative consultations with key stakeholders, pressure tested to see if they were feasible, and essentially basically trying to identify any new or novel solutions that were out there. And this led here to an initial list of hypotheses, which were of 25. We then went on and used a set of 4 guiding principles, which are in the middle of the slide here, to refine these initial hypotheses iteratively and help prioritize the list of solutions. So these guiding principles are feasibility, sustainability, potential for impact, and relative costs. First, we focused on which solutions of that initial list were most feasible for MNCH products and focused on that in our consultations with the key stakeholders. So given relative market dynamics, which of the solutions were feasible? We also use feasibility here as a gating factor. So you'll see this dotted line in the middle of this slide as well. So for those hypotheses determined not to be feasible, we didn't look at them further. And this surfaced about 18 solutions to be feasible on our list. And then through further iterative consultations and pressure testing with stakeholders, it expanded to a list of 21 as we moved from higher level themes being identified in those solutions to putting a finer point on what those solutions could actually look like and what those interventions might actually require. So for example, on our list, which you'll see in a little bit, we had we have right now a reference price list that is being recommended to be developed, but with further consultations, we noted that there needed to be TA support to actually integrate that reference price list into country processes, and therefore that list expanded with that finer point. And then finally on this slide, here at the right-hand side, based on these 4 guiding principles and consultations with the key stakeholders, solutions were prioritized within each market bucket because of the importance of addressing the multiple market barriers simultaneously. And then we also went and customized the solutions by geography and based on context, challenges, and identified priority needs. We identified customized solutions by geography. So here in the next slide, just a quick overview, which you'll see as we get to the solutions. This really highlights 5 solution types that you'll see emerged across country, regional, and global levels. And these solution types are likely ones you're already familiar with. So a guidance or reference document, for example, financing for commodities, technical assistance, advocacy, or coordination mechanism. And in each geography, as I've mentioned before, we customize these solutions based on the context. So the next 2 slides here will just unpack some of the guiding principles. So already covered feasibility in a previous slide, but when I said sustainability, what did we really mean, or impact? So for sustainability, we explored the perceived political will in country and donor interest for each of the potential solutions, presuming that there needed to be some external support for these solutions in the near term, but with an emphasis on the longer term country-led sustainability for each solution, since MNCH medicines are already largely government financed and procured, so really wanting to focus on the longer term sustainability where the country is driving that. And for potential for impact, we looked to compare solutions within each of the market buckets to one another to understand which of them might drive the most impact. So because of the absence of economic impact assessments for market shaping solutions, we ended up leveraging data from our phase 1 analysis, our past experience, as well as available data in the public domain to look across 3 metrics, which included cost savings, potential for increasing volumes of medicines, as well as improving process efficiency. And then for relative costs on this next slide here, we, given the range of solutions that we looked at, it wasn't possible to cost each of the solutions individually in each of the countries that we were looking at. So we assigned relative costs by solution type, taking into account known geography-specific considerations. So here you can see, for example, that guidance documents and global goods are likely to have lower relative cost than country-specific TA, for example, which is less costly than a coordinating mechanism across countries, which might include support to a larger number of countries or creation of a convening platform, for example. And then again to note on this slide, while the overall cost was assigned to each solution, we did make adjustments again based on that country-specific settings. So for example, if a country had an existing pooled fund, as in Ethiopia or Tanzania, the relative cost to expand or sustain that pooled fund was expected to be less costly than what it was needed to actually establish a pooled fund in another focus geography. So the 3, actually all 4 of those guiding principles, the feasibility, sustainability, potential for impact, and relative costs, they help determine that question, how market shaping solutions could be deployed to address the market challenge, as well as at which level, was it country, regional, or global. And our final question, which is on the right-hand side of this slide here, was to determine who should also be involved to implement these prioritized solutions. So we identified several principles to consider how to identify those that should be involved across donors, implementers, and institutional homes, which is on the right-hand side of the screen here. So for donors, we looked at, because the network of donors is quite active in the MNCH space, but it's also evolved, we focused on donors that could be currently active, who were currently active in this space, or believed to be entering based on their strategic priorities. Then for implementing partners, we did not provide a full list of partners because there's quite a range and a diverse range of implementing partners in the landscape, but we did think through principles of how to choose them, which is at the box at the bottom here. So for example, subject matter experts. And then aligned with our principle on sustainability, for the institutional home, we focused on working through existing mechanisms and entities, having these solutions be housed in those existing mechanisms and entities. And so the institutional home for most of these solutions is the relevant government body with related authority. However, there were some solutions that were at the global level, and so we're likely to reside with organizations that have global reach. So now finally turning to our findings to share with you all, we ended up based on that iterative co-creation process I just went through, as well as those 4 guiding principles of feasibility, sustainability, potential for impact, and relative cost, we saw that 21 solutions emerged as priority across the geographies and 3 levels, which were grouped here by market bucket again. So you can see financing, procurement, pricing, quality, product selection at the bottom, as well as cross-cutting. And most of these are probably familiar to you as well in the MNCH field, but this is quite a holistic view of what was emerging as priority across the geographies. We also identified that most solutions really need to be implemented and require country level action. So they don't have an icon next to them, but you will see that there were a few that were identified as regional and global. And so the regional ones have the continent of Africa picture, and then the global ones have a globe icon right next to them. And so this is the overall solution menu across all 5 focus geographies that we were looking at. But as I'd mentioned, because the vast majority were best placed at the country level, a right fit set of solutions really varied by geography. And so you can see that on this slide, where we have put together a chart. All the solutions from the previous slide, that menu slide, are on the left-hand side of the chart here, grouped into their bucket. And then on the right-hand side, you can see the countries of focus and which solutions are rising to the top in terms of which ones have been prioritized based on the guiding principles. So if you see it, like one of the cells here basically means that the solution is a priority in that country, but we were not aware at that time that they were actually being implemented or with donor support. But cells that are striped were also identified as emerging and priority solution, and we know that they're being pursued by other partners or initiatives right now. And you can also see here some nuance that, in that the solutions and the number of solutions vary across the country. And one thing to note is in this co-creation process, we did consider the context of each country, as I'd mentioned before, but as these solutions move into implementation, they really need to be further contextualized to each country's specific needs. So moving into just some quick highlights of what we were seeing across each country and which solutions were rising to the top or being prioritized. So on the left-hand side here, some insights per country. We saw, for example, in Ethiopia, solutions were really focused on expanding and rationalizing available financing from all sources, as well as TA for procurement functions was also coming up as likely to address the current pain points and complement system-wide market support. In Kano, Nigeria, where fewer donors are active, financing solutions aimed at increasing domestic resource mobilization and use, along with solutions aimed at improving market transparency and engaging domestic private sector. In Tanzania and Uganda, there was a high-level interest in a country-level market manager function that has a line of sight across all those 4 market buckets and can address persistent financing, product selection and procurement challenges, as well as respond to future MNCH market fluctuations. And then in Kenya, with the unique devolved health system, which requires commodity-related interventions to be responsive to and driven by county decision makers. So understanding which solutions is right fit in a particular county then is quite important. And then here on the bottom of the right-hand side, we also identified 2 solutions along with the country-specific solution sets. We identified 2 solutions that sit more at the global level. So a global reference price list and quality assured supplier list was surfacing through conversations and analysis as a priority. These solutions really span geographies, and the goal here is really to collate and disseminate pricing and quality information, and in order to reduce information asymmetry and increase market transparency across all geographies. And so, I mentioned that the solutions varied by geography. And so this slide here is just one example of a solution-specific slide that we customized for each solution in each geography, which we then shared back with our key stakeholders in each of those focus geographies. So, for example, this slide includes a summary. This is a country-level MNCH market manager. It includes a summary of what the market challenge is that the solution will address. It just includes a high-level description of the solution, and then more specific considerations in the chart at the bottom here of what it will require in order to be implemented in a particular context, including how it could be successful, the potential challenges that were surfaced in the discussions, and the complementary solutions it could be paired with from that list of solutions in the menu. And then it also includes at the bottom the institutional home. So in this case for Uganda, where the country level market manager solution is a priority solution, it could potentially be housed in the MOH reproductive and child health department. And then on the right-hand side, we also did summarize what the solution type is, the sustainability rankings for donor will and country or political will, and then the potential for impact it could have. For the market manager solution as well, since it's a cross-cutting solution, we also highlighted which solutions on the priority list for Uganda it could help implement as well. So For example, the country level market manager could help to implement TA to optimize utilization of donor financing. And so these more detailed solution slides, this is just one example, but they have been shared back with each geography as well as with the key stakeholders in each of our geographies, as well as been vetted by them and validated as a part of that co-creation process that we were taking. So moving into looking ahead at implementation of these solutions, zooming out really quickly first, actually, we wanted to touch on the key takeaways from the solution creation, co-creation process work with the aim to drive access to MNCH medicines. So unsurprising to you all, we found overall that transforming access to priority MNCH medicines really requires diverse solutions working in concert together to address the interconnected challenges across financing, product selection, procurement, pricing, and quality. And then, while we also did observe similar market barriers across products spanning the different market contexts, the underlying causes and contexts really differed by geography. And so the right set of solutions really need to be focused at that country and contextualized to that country context. And then lastly, which is something to this section will really focus on, is that catalytic implementation, as we're thinking ahead about that, will span a variety of different market contexts. So the market size and health system, for example, will really offer some of the richest learning opportunities on which solutions to drive impact. We also have a few summaries here by market bucket, but I'll move on as this is something that could be for reference as well. So as I've mentioned, looking ahead and looking forward to catalytic implementation of these solutions in a mix of different market sizes and market types will offer that rich learning opportunity to scale up access to MNCH medicines and drive impacts across these countries and different market characteristics. So the focus geographies for this project were really selected based on that thinking. And it was to generate evidence on solutions that could work with different country archetypes. So for example, in this project, we wanted to identify not only how to move the needle on MNCH commodity access in the countries that we were specifically working in, but then also provide a range of instructive archetypes for transforming access to other countries in this region. And so we looked at a mixture of 4 different factors. So impact, so the burden, various market sizes, differing health system structures, as well as care seeking in the public and private sector, as there are varying, health systems on the continent and with different care seeking levels. And then considered where there were strong stakeholder relationships to help facilitate data collection and conversations. And so we've grouped really on the right-hand side of the slide, we grouped the countries that we were working in based on some of these market characteristics, for example, to just illustrate the different market archetypes that we were trying to include in our project, and then can also be looked at moving forward when we are thinking about implementation. For example, here in the chart, Ethiopia, Tanzania, and Uganda, they're all centralized health systems with procurement decisions being made at the central level, but they have varying population sizes. Then in contrast, Nigeria and Kenya are devolved health systems. And so just kind of a range here in the chart of different market archetypes. And the last slide in this section here is just to say that the work that we have done in the past 2 phases of this project really fit into R4D's larger approach of working with leaders to solve their immediate challenges while strengthening the underlying system. So while the approach here is rooted in analysis in phase 1 and phase 2, it's always really with a bias towards action. And so our entry point challenge in this project was insufficient access to MNCH medicines And then through phase 1 and phase 2, we've looked at, we've looked at holistically the set of solutions to improve the market, kind of represented here and trying to look at that market ecosystem. And as we wind down this phase of the work, we're looking forward to opportunities for catalytic implementation of solutions in these focus geographies or similar archetypes, geography archetypes, as mentioned in the previous slide. And this is because we've done a lot of the fact finding, so we're really hoping to turn this into action. So some of the work that is moving forward, we are currently exploring with the Gates Foundation opportunities to take forward the global reference price list, as well as quality assured supplier list that was mentioned previously as global level solutions, as well as implementation of some procurement and financing solutions in Ethiopia. And, as I open it up to discussion and close off this presentation, it'd be really great to start the discussion on opportunities for implementation and or synergies with recent ongoing work that the group might also know of that would be great to put on our radar. With that, I will end how much I am talking and really open it up to see if there are any questions from the group that we can help answer. And then there are a few sets of questions here that we can dive into as discussion. As I note, we actually have a lot of time left in the webinar, so hopefully can stimulate some conversation. Thank you, everyone. Appreciate it.
Thank you very much, Leica, and very, very interesting presentation. I've seen the presentation before, so I was just reviewing back, and you I think have focused in those countries and regions that have the highest impact in terms of maternal mortality and infant mortality. So this is the time for questions. We're not that big a group, so if someone wants to open her microphone and ask the question, that will be fine. Or you can always put your question in the chat box.
Hi, Milka. This is Jeff.
Hey,
Milka,
Jeff.
this is Jeff.
Hello, welcome back.
Thank you. Thank you. So, Leica, thank you for the presentation. Just a quick top-line question. On the country level MNCH market manager, how do you see that existing today at a country level, or is that something that would need to be created, and where's the financing for that?
Sorry, I was on mute. Yes, Jeff, welcome back. It's really great to connect with you again. Yes, so the market manager, we are actually already working as the market shaping practice. We're working in Ethiopia already on a market shaping directorate, which is being driven by the country of the government of Ethiopia, with interest to have that line of sight across the different market aspects. So they're taking a look at, across, I believe it's essential medicine, so it's not just specific to MNCH medicines, but we are already supporting the government to work on this country level market manager initiative. And there has been interest as well in Uganda and Tanzania as well for this idea to move forward, especially at the high levels. I can add a bit more information if you'd like, if that would clarify. I also, if Emma wants to come in and add some more information, I'm happy to.
So thanks for that. But the one question partially that I'm interested in is where does the financing for that I'm assuming it's an individual, or as you said in Ethiopia, a directorate in Ethiopia. Is it the directorate itself that's planning on financing, or are they looking for donor funding for that? Same thing for Tanzania, Uganda. Who's funding it?
Yeah, so the market shaping directorate in Ethiopia is the only one that has taken off so far. And I believe that there's a combination funding there. So there's the directorate staff is funded by the government of Ethiopia because this is their initiative. They want to drive this forward. But I do believe that there is some donor funding to help stimulate that and fund some of the activities that are ongoing. But it's a government of Ethiopia initiative. So definitely funding by the government itself. In Tanzania and Uganda, since it's just an idea so far, I think that's still further in development, but we can use the example in Ethiopia, which is the government's interest and government's investment in building out a directory like this, and then getting support from donors, getting support from implementing partners to help them move this forward.
Okay, we have Saumya Ramarao. Saumya, you can ask the question. Yeah.
Okay.
Go ahead.
Thanks, Lekha, for that very rich presentation. There's so much information that I bet a lot of it I missed, and I'll probably have to review it a couple of times. Anyway, so thanks again. And two questions for you. The first is around whether mifepristone could be included as a medicine, because I don't think I saw that in the list of medicines that were being reviewed. It seemed that the bulk of the medicines were coming from the UN Commission list. So anyway, so that was one. The first question was around what's the possibility of including mifepristone? And then the second one is more around financing. When you were meeting with the stakeholders, what sense did you get about financing coming from the GFF? Because they do have their reproductive health policy writ large, and this fits squarely within that. And second, at the country level, the possibility of including it within universal health coverage and the various types of financing mechanisms they might have depending on the country. Thanks.
Thanks, Soumya. Yeah, I can take a shot here. So the list of medicines, to clarify, were really from a list of government priorities. So in our first phase, we looked at what were governments already procuring at high volumes and funding by themselves. And then what were they quantifying, as well as what some of the funding gaps were, or the need was that was missing. And so the groups of the 14 priority medicines really came from those government priorities, which we then validated with the different key stakeholders in those countries as well. So mifepristone, if I remember correctly, was originally on that list, but just through that analysis, I think it was coming up maybe only 1 or 2 countries, and this was looking across all 5. So we focused, I think misoprostol was the one that was more of a focus in the government priorities at that time when we were speaking to them. But you know, it could, if we wanted to extrapolate, it could experience some of the same challenges in the market that we were seeing for these other MNCH medicines. So solutions really could also help increase access to mifepristone, maybe not specific to, we didn't look in this project specific to each of the medicines and the different solutions. So there was really like a basket of solutions we were looking across it. In your question about financing and interest coming from GFF, we've had several conversations with GFF. We've also spoken with the country level. And I think there has been interest that's come up, but in the process, I think GFF is also continuing to develop their strategy or defining that strategy. And so in our ongoing conversations, if I understood them correctly, it was really trying to understand first what is their strategy and define that before they commit to anything, if I can say that. But there was interest in terms of interest shown for some of these solutions under financing. And then under country level and on, you know, integrating this into the UHC program, I can speak, I was leading the Kenya specific work, the Kenya specific work stream, and already, you know, in Kenya, MNCH medicines are being included in the UHC package. They're including MNCH medicines in the quantification that they're doing nationally. And so we are seeing this kind of uptake and investment on shaping the market for some of for UHC and MNCH medicine being included. Maybe let me know if that answered your questions or can help elaborate.
No, that's good. Thanks. Thank you.
Okay, I have Jane Briggs. Go ahead, Jane. Thank you.
Thanks, Milka. Hi, Lekar. Good morning, afternoon, everybody. Great work. This is a really impressive piece of work. And I know that we and your team have had conversations over a period of time, but it's so nice to see this kind of come together and really kind of consolidate a lot of really important information. I have two questions. Obviously, this is important for us to kind of all take on to move forward. This is not just something that R4D is taking forward, but you've laid out kind of clear next steps to for the global community and countries to take these solutions forward. But my first question is, was there any real aha moment as you were going through this analysis? Because there's a lot of interventions there that we kind of all know need to be done, but for a variety of reasons, it hasn't got kind of global momentum, country momentum, or whatever else. So what out of your list of interventions was there really, oh, that's the missing piece, that's what needs to be done? You know, quantification, TA, Paris reference guide, all these things are kind of ongoing, but we haven't moved the needle yet. So what's the aha moment that came out of this work from your perspective? And the other, maybe an easier question is, what's the role that you see for civil society? Because I think you talked about different stakeholders, and you obviously talked about Ministry of Health or government, donors and implementing partners, and institutional homes. Is that what you said? I think the other group was.
Yeah.
Where's the role of the civil society, and do you see a role for them? And is that something you've discussed with your country stakeholders? Thanks.
Mm-hmm. Yeah, great questions. I can start off, and then maybe Emma, my colleague, might also come in. Great questions on the aha moment there. I could be biased because this is, as I was working through this for 3 years, I was really learning a lot. In the maternal, newborn, and child health space. So hearing from stakeholders, you know, especially as you said, Jane, not a lot is new, but they were very excited to have this holistic view of across the market, across, you know, those market buckets that we were looking at. What are, you know, what does that look holistically, as well as the understanding that things are quite interconnected. So even if you choose one thing, there really can be impacts if you're looking at a bucket of solutions. So I personally wasn't hearing anything that was like one solution was really creating this aha moment, as you're saying, but the desire and the interest to learn about what their market looks like, as well as sharing back and co-creating with them what the solutions could look like in their specific country context, holistically across the market, was really where we saw a lot of the value and the interest and the desire, and helped with increasing some of that political will as well that we were talking about, interest to move some of these things forward, which, as mentioned in the catalytic implementation section, did move forward for example, in Ethiopia, as well as for global level solutions. There was this interest to move it forward, instead of, you know, yeah, it catalyzed that desire to move things forward after having a holistic view.
Like maybe this is Emma, maybe I can come in as well. I think, Jane, part of the aha is that there is no aha. I think we had wanted, you know, we were really hoping there would be a silver bullet or an undiscovered, explored avenue here. And I think, as Leica tried to mention, many of these solutions, both the types and some of the specifics even, are well known to this group who's been kind of plodding along in the maternal health space for a long time. One thing that did catch my attention was that we know that governments are leading financing and procurement for these commodities, and still there's a demand for technical assistance for domestic resource mobilization and use. So I think where we see, we know in donor funded programs, family planning, malaria, and others, there's an increasing shift to need domestic resources for sustainability and things of that nature. But I think we sometimes forget that where we have those resources already, the government still needs additional support to be able to mobilize more. So I think that's one place where kind of maybe what we would have expected and what we observed were not the same. We didn't see an appetite to get more donor support. We saw an appetite to get better support to be able to mobilize resources domestically. And I can also come in on your second question about CSOs as well. I think this kind of work that we were looking at, the market shaping, has, I don't want to say no role for civil society, but more of a role in terms of when I was at PATH, what we call technical advocacy, where folks who were really deeply engaged in some of the commodity work were acting sort of as a watchdog or other things. And we do have a couple advocacy related solutions. So advocacy to align what's being procured with what's in the country guidelines. I know PATH had done some work with advocacy for better health and others that would help with that. And then also advocacy to really build the appetite of the government to work with the domestic private sector to make these commodities available. So I think when I hear CSO, I immediately sort of think advocacy. And so those are the immediate entry points, but I do think there's probably other ways, although most of the focus was kind of on internal government strengthening as well. So I hope that's helpful.
Yep, great, thanks.
Thank you, Emma. Thank you. Any other question? I don't see your hands. Let me see. All right.
Yeah. If no other questions, Milka, and if it's okay with you, maybe just turning to asking the group now. The first question here that we have up. You know, we in our original research and development of the initial set of hypotheses, we did look at a lot of the work that was going on in this field and previously, as well as in other product areas. But is there any work, you know, more recently that's ongoing that any of the partners are involved in right now, where who sharing these findings with would prove useful, prove helpful? And then also, is there any current ongoing work for these solutions in other product categories that could be really instrumental in an implementation phase for us to know about? Would be really great to hear from the group any ideas and stimulate that kind of discussion.
So I'll chime in here. I mean, I would assume, and Sarah Rouchlin's on the call from Concept Foundation, I would assume that this work would be quite relevant for the work that they're doing to support uptake, adoption, etc., for both TXA and heat-stable carbetocin. I missed the beginning part of the presentation to see if those products are part of your list, but I think the concepts are the same.
TXA and HSC were not part of the list, but similarly to mifepristone, could really see some similar challenges coming down the line. Yeah, thanks for sharing about Concept Foundation. Anyone else or any other partner that would be helpful for us to share this information with? Be great to hear some ideas.
Hi, Chris here.
Hi, Chris.
Hi, and thanks for the great presentation and the work from RFOD and the Gates Foundation for funding this. I just want to say from options, we are currently working with USAID and Chemonics to develop MNCH commodity kind of an introduction and scale-up tool, which could be used for existing or newer products like what Jeffrey is talking about, TXA and the rest, to introduce or scale up some of the underutilized commodities. So it's something that we just started in like 2 months, and some of your work definitely is really important. Like, especially I was just checking the procurement, financing, also issues, and also other system issues, what you're talking about, market manage and all that. So definitely it's complementary to what we are doing, and will add value as we develop progressively this tool. I think we've had initial conversations with Milka and also Emma to really discuss on how they see this tool be useful for countries as a global tool, but of course will have to be customized to countries once they want to adopt this. So I think that's something we are working on, and I guess would be useful to keep on track, and we'll update as soon as we have like a proper draft to share with the team. And maybe just a quick one, just to ask, is on the various, there was a list of commodities you had, the medicines. Was there anything which really stood out for some of these? I know you're talking about bundle of services and all that. Any of these commodities which in those 5 countries that you think more needs to be done in terms of scaling up some of the use, or for instance, in aid of these buckets you're talking about finance and selection, that more attention needs to be paid for, especially MCH or maternal health? I just was curious about that, but thanks for this amazing work. Over.
Thanks, Chris. That's great to hear about the ongoing work, and would love to hear, once you finalize the medicines that you're going to be working on for your tool, that'd be interesting. For your second question, for which of the 14 priority medicines did we see anything come up? So in our market analysis, kind of overall, we looked at each of these medicines, as in the procurement volumes and financing, but looked across all of them when we were analyzing the market. We did have a few things that coming to mind just right now. I'd have to go back to the diagnostic presentation from a year and a half ago, but we did see for I believe it was chlorhexidine, as well as zinc and ORS, a lot of fragmentation of how many different products, as well as ferrous sulfate, folic acid, how many different versions of those products were coming into the country. So there was a lot of fragmentation in the market in each of these countries, and therefore it really had impact on where the financing was going, and some of that product selection was not as aligned to country guidelines, or even sometimes global guidelines. So I think that's the first thing that pops into my mind about anything that was like coming up as key. A majority of these medicines were being financed by the government already, and being procured by the government. There were a few that were being donor financed, but as a caveat, the data was from 2016 to 2018. So situation could definitely have changed, but speaking kind of from that data set that I have in my mind right now and what we analyzed.
Okay, there was a question here on UN, on what's the UN Commission on Life-Saving Commodities. It was a big effort that the UN started in 2014, 2015, and there was a special work stream on maternal neonatal child health medicines, and the maternal health supplies caucus, we inherited part of that work of the UN Commission on Life-Saving Commodities, and the child groups are taking on some of the 2012 to 2016. Jane, your memory is better than mine. Yeah. So from 2012 to 2016, 4 years. And then when the UN Commission ended its mandate, we took on the work on maternal health supplies. I just wanted to tell you, Leka, the RHC, through the Innovation Fund, is currently funding Uganda and Benin on an advocacy effort for mobilizing domestic resources. So it might be interesting for you to contact my colleagues working in that effort, especially because we overlap in Uganda, right?
Yeah, absolutely. Thanks so much for sharing that. Let me.
All right. Any other? We're almost on top of the hour, and I don't see any more hands. I would like just to say thank you very much, Leka, Emma, Stuart. Thank you so much for this presentation. Thank you for the pre-reading material. And now I hope to see you soon. We should be having a maternal health supplies caucus meeting in the next weeks. So stay tuned. And thanks again for being so punctual today. Yes, this has been a lot of information in a short time, but we will share the summary document that R4D has prepared, and there will be this recording available for you in our website. So until the next webinar or meeting, thank you so much and have a great day, a great afternoon, a great evening. Thank you all. Thank you, Leka. Excellent presentation.
Thanks so much. Take care.
Bye-bye.